Welcome to the Holistic Cancer Care channel. We all know we need oxygen to breathe, to fuel our cells, to live. But could oxygen also hold the key to fighting cancer? Oxygen therapy has gained attention as a potential complementary treatment for cancer. It's crucial to understand the science behind oxygen therapy and separate hype from hope. Before we begin this video, don't forget to subscribe to our channel for more tips and turn on notifications so you never miss our new videos. Oxygen therapy involves increasing the amount of oxygen in the body. This can be done through various methods, each with its own mechanisms. While oxygen is vital for healthy cells, its role in cancer is complex. This essay will explore different aspects of oxygen therapy, examining the scientific evidence and addressing common myths. It's important to remember that cancer treatment is not one size fits all. It is designed to provide information, not medical advice. Always consult with your healthcare provider to determine the best course of treatment for your individual needs. The Warburg Hypothesis, named after Nobel laureate Otto Warburg, suggests that cancer cells have a different metabolism compared to healthy cells. This groundbreaking idea has sparked a lot of interest and research in the scientific community, as it challenges the traditional understanding of how cancer develops and thrives. Normal cells use oxygen to produce energy efficiently. This process, known as cellular respiration, allows cells to generate the energy they need to function properly and maintain healthy tissue. Cancer cells, however, rely more on a less efficient process called fermentation, even when oxygen is available. This means that cancer cells produce energy in a way that is fundamentally different from normal cells, which could have significant implications for how we approach cancer treatment. This metabolic difference has led to the idea that increasing oxygen levels in the body could potentially inhibit cancer cell growth or make them more vulnerable to treatments like chemotherapy and radiation. By targeting the unique metabolic pathways of cancer cells, researchers hope to develop more effective therapies. While intriguing, the Warburg hypothesis is still a topic of debate within the scientific community. Some researchers believe it holds the key to new treatments, while others argue that it oversimplifies the complexity of cancer. It's essential to remember that cancer is a complex disease with multiple factors at play. Genetic mutations, environmental influences, and lifestyle choices all contribute to the development and progression of cancer. Metabolic differences are just one piece of the puzzle. Understanding the full picture requires a comprehensive approach that considers all aspects of the disease. Further research is needed to fully understand the implications of the Warburg hypothesis for cancer treatment. Ongoing studies and clinical trials will help determine whether targeting cancer metabolism can lead to more effective therapies. It's crucial to approach these concepts with a critical eye and rely on evidence-based information. Only through rigorous scientific investigation can we hope to uncover new and better ways to treat cancer. Oxygen therapy encompasses various methods, each delivering oxygen in different ways. Hyperbaric Oxygen Therapy, or HBOT, involves breathing pure oxygen in a pressurized chamber, increasing the amount of oxygen dissolved in the blood. Ozone Therapy introduces ozone, a form of oxygen, into the body, typically through intravenous infusions or rectal insufflation. Hydrogen peroxide therapy involves administering diluted hydrogen peroxide intravenously, aiming to increase oxygen levels and stimulate the immune system. It's important to note that these therapies are not FDA approved for treating cancer and should only be administered under the supervision of a qualified healthcare professional. Each method carries potential risks and benefits. Discussing these with your doctor is crucial to make informed decisions about your health. Scientific research on oxygen therapy for cancer is ongoing, with mixed results. Some studies suggest that certain forms of oxygen therapy might enhance the effectiveness of conventional cancer treatments like chemotherapy and radiation. Others indicate potential benefits in improving quality of life for cancer patients. However, it's important to acknowledge that many of these studies are small and have limitations. Larger, well-designed clinical trials are needed to confirm these findings and establish clear guidelines for using oxygen therapy in cancer care. The American Cancer Society cautions that oxygen therapy should not be considered a proven cure for cancer. It emphasizes the importance of relying on evidence-based treatments and consulting with qualified oncologists. While oxygen therapy shows promise, it's crucial to approach it with realistic expectations and a critical eye on the available evidence. Debunking the myths, separating fact from fiction. Several myths surround oxygen therapy and its role in cancer treatment. One common misconception is that oxygen directly kills cancer cells. While oxygen is essential for cell function, simply increasing oxygen levels does not automatically destroy cancer cells. Another myth is that all forms of oxygen therapy are the same. As discussed earlier, hyperbaric oxygen therapy, ozone therapy, and hydrogen peroxide therapy have different mechanisms and potential risks and benefits. It's also untrue that oxygen therapy can replace conventional cancer treatments like surgery, chemotherapy, or radiation. Oxygen therapy should be considered a complementary approach, potentially enhancing the effectiveness of these treatments. Relying solely on oxygen therapy and foregoing conventional treatments can be dangerous and negatively impact your health. Is oxygen therapy right for you? Potential benefits and risks. Whether oxygen therapy is appropriate for an individual with cancer depends on several factors, including the type and stage of cancer, overall health status, and potential risks and benefits. It's not a one-size-fits-all solution, and careful consideration is necessary. Some people with cancer might experience improved energy levels, reduced fatigue, and a general sense of well-being with oxygen therapy. This can be particularly beneficial for those undergoing intensive treatments. Additionally, enhanced wound healing is another potential benefit, which can be crucial for patients recovering from surgeries or other invasive procedures. However, it's crucial to acknowledge that oxygen therapy can also have side effects. These side effects can range from mild to severe, depending on the type of therapy and the individual's health condition. Hyperbaric oxygen therapy, for instance, can cause ear problems, temporary vision changes, and sinus issues. These side effects are usually temporary but can be uncomfortable. In rare cases, lung damage due to oxygen toxicity can occur, which is a serious condition that requires immediate medical attention. Ozone therapy and hydrogen peroxide therapy also carry potential risks, including allergic reactions, blood clots, and infections. These risks should not be taken lightly. Additionally, these therapies can cause damage to red blood cells, which can lead to other complications. It's essential to have a thorough discussion with your oncologist to determine if oxygen therapy is appropriate for your specific situation. They can provide personalized advice based on your medical history and current health status. They can help you weigh the potential benefits against the risks and make an informed decision based on your individual needs and medical history. Always consult with your healthcare provider before starting any new treatment. Integrating oxygen therapy, a complementary approach to cancer care. Oxygen therapy should always be viewed as a complementary approach to cancer care, not a replacement for conventional treatments. It's essential to continue the treatment plan recommended by your oncologist, which may include surgery, chemotherapy, radiation, or a combination of these therapies. Oxygen therapy, when used safely and appropriately, might have the potential to enhance the effectiveness of these treatments, improve quality of life, and support overall well-being. Open and honest communication with your healthcare team is crucial when considering oxygen therapy. Inform your oncologist about any complementary therapies you are interested in or are currently using. This will allow them to provide personalized guidance, monitor your progress, and ensure that all aspects of your care are coordinated effectively. Oxygen therapy, not a standalone solution, but a potential ally. It's important to reiterate that oxygen therapy is not a standalone solution for cancer. While it holds promise and ongoing research continues to explore its potential, it's crucial to manage expectations and avoid false hope. Cancer is a complex disease, and treatment requires a multifaceted approach tailored to each individual's needs. Oxygen therapy, when integrated safely and appropriately, may play a supportive role alongside conventional treatments. Remember, your healthcare team is your most reliable source of information and guidance throughout your cancer journey. Engage in open and honest conversations with them, ask questions, and express your concerns. Empower yourself with knowledge and make informed decisions about your health in collaboration with your healthcare providers. Thank you for watching. If you found this video insightful, don't forget to give it a thumbs up. It helps support our channel. Hit the subscribe button and turn on the notification bell so you never miss an update on our latest educational content. And please share this video with your friends and family to help spread awareness and knowledge. Together we can make a difference. See you in the following video.